Hi, my name is Nagina Safarova. In this video, I'll be demonstrating periodontal probing and explaining how to measure clinical attachment loss, or CAL. Periodontal probing is the process of measuring the depth of the gingival sulcus or periodontal pocket around a tooth using a periodontal probe. Clinical attachment loss refers to the distance from the cemento-enamel junction, or CEJ, to the base of the pocket. It represents the true loss of supporting tissue and is essential for diagnosing periodontal disease and planning effective treatment. So this is the University of North Carolina UNC 12mm probe. It is utilized to measure probing depth, PD, and gingival margin, GM, and we will use a mirror to see lingual or sometimes buccal areas. So what we're going to be measuring is 6 sites per tooth, so that applies, we're going from distal facial, mid facial, and then mesial facial, which will be again distal lingual, it would be mid lingual, and then medial lingual probing sites. It would be the same thing for gingival margin, same sites for gingival margin, which I'll demonstrate how to measure that later on. It's very important when probing to keep the probe parallel to the long axis of the tooth for all teeth. When probing, start at the distal line angle and gently walk the probe toward the coal space. That's the area between two adjacent teeth beneath the contact point. Do not remove the probe between sites. Instead, keep it in place and walk it along the sulcus to locate the deepest pocket on the midfacial surface. Continue walking toward the mesial side, keeping the probe parallel to the long axis of the tooth. At the mesial, remember to measure into the coal space, which represents the interproximal area. You should always record the deepest reading for each of the 6 sites per tooth. Now we'll do the same procedure for the lingual surface. Insert the probe parallel to the long axis of the tooth starting at the distal line angle, and walk the probe toward the coal space. Continue along to the midlingual, then toward the mesial line angle, and finally measure again at the coal space on the mesial. When recording in dentrix, probing starts from the distal line angle of the most posterior tooth on the facial surface and proceeds anteriorly, for example from the upper right third molar or second molar all the way to the upper left molars. After completing the facial surfaces, switch to the lingual surfaces and probe in the opposite direction, returning toward your starting point. For the mandibular arch, follow the same sequence. Start on the facial surfaces, move from right to left across the arch, then return on the lingual surfaces. Each tooth must be probed at 6 sites: mesiobuccal, midbuccal, distobuccal, mesiolingual, midlingual, and distolingual. Now let's demonstrate probing for tooth hash 26 as an example showing recession. Insert the probe at the distal line angle and record the readings as follows: 5, 3, 5 on the facial surface, on the lingual, record 4, 3, 4. So for tooth hash 26, the probing depths, PD, are 5, 3, 5 facially and 4, 3, 4 lingually. Next, let's measure the gingival margin, GM levels. Lingually, -2, -1, -2. Facially, we have -5 plus 2 -5, and now to calculate clinical attachment loss, CL, we apply the formula CAL equals sin PD plus recession, or PD overgrowth, depending on the gingival margin position. For this example, there's 2 mm of gingival recession on the midfacial area. The PD at the midfacial is 3 mm and the GM is positive, plus 2 mm, giving a CAL of 5 mm. On the lingual, there's no recession, so we subtract the gingival margin from the probing depth. 4, 2 equals sin 2, 3, 1 equals sin 2, 4, 2 equals sin 2. Therefore, the CAL values on the lingual are 2, 2, 2. This demonstrates how to properly determine clinical attachment loss, CAL, and accurately record measurements in both facial and lingual areas. There are 4 stages of periodontal disease classification according to AAP 2017 classification guide. If the interdental clinical attachment loss, KL, is between 1-2 millimeters, it indicates stage 1 mild periodontitis, also known as initial periodontitis. When the interdental CAL is between 3-4 millimeters, this represents stage 2 moderate periodontitis. Remember, interdental CAL refers to the measurement between the teeth. It helps determine the severity of attachment loss. For stages 3 and 4, the CAL is 5 millimeters or greater. This indicates severe periodontitis. In stage 4, there is advanced tissue destruction, often accompanied by furcation involvement and tooth mobility. Now let's review grading. Grade A indicates a slow rate of progression. This is rare, as most patients begin at grade B, which reflects a moderate rate of disease progression. Patients may be classified as grade C if they show a rapid rate of progression, are smokers, or have an A1C above 7%. Most individuals typically fall within grade B for both staging and grading during charting. For example, if a patient presents with significant recession on the mesial and distal areas and the interdental cal is 5 millimeters or more, it would be considered a severe case. If there are false pockets due to gingival overgrowth, it may be classified as moderate. When evaluating the interdental regions again for classification, 1-2 mm cal equals sign mild, stage 1, 3-4 mm cal equals sign moderate, stage 2, 5 mm cal equals sign severe, stages 3-4 advanced.
If in this case for recession, if there was a lot of recession on the mesial and distal areas, this would make it, let's say if the CAL, the clinical attachment loss, was 5 or above millimeters on the interdental, this would be a severe case.